Welcome to Health and Hormones with Dr. Allen. I'm here with my partner, Ben Ashby, and we're excited to talk to you about a very important topic and something we see all the time in our office.
I was fake sleepy.
Yeah, exactly. We're going to talk about fatigue.
Sammy was like, what the heck is he doing? I'm sorry. I started dozing like this, and she looks at me.
Well, that's what we're going to talk about. If you fall asleep in the afternoon,
you can keep that intro.
Yeah. Well, welcome, everybody. Glad to have you join us. All right, Ben.
Excited for this one today?
Yeah.
Jeez.
I probably think it's one of the most common symptom we see is fatigue, right? Yeah. It is unfortunately becoming more and more common. And when I first started doing hormone therapy, it was in people that were, 50 and older, right? They had these symptoms. And now the age is getting so much younger.
Younger and younger. Wow.
Yeah.
Well, and we were kind of talking off camera, but I know signs and symptoms of fatigue are pretty obvious, but let's go through them. Sure. That, maybe like one that I didn't think of as a sign of fatigue, which was brain fog. Right. Can be a sign of fatigue. So, Absolutely. Go into some of the other signs and symptoms if you're experiencing this.
Yeah. So, fatigue can happen at all parts of the day, and it can also happen at all ages, right? But if you're getting a good night's sleep and then you wake up and you're exhausted, there's something usually off that needs to be addressed and looked at and studied. The first thing that everybody should always be checked for if they're not sleeping through the night is something like sleep apnea. But everybody in medicine now tests for that. So everybody's doctor, that should be just standard to work up. And so we'll because everybody's doing that, we'll kind of put that to the side. The other things, problems with fatigue is what happens to you through the day. Are you, and sometimes it happens so subtle because people just start getting their energy drinks, right? Or they're self-medicating with some form of energy that it helps them get through the day. And like, I need that so I can perform. And they don't realize that they're starting to medicate a problem going on in the body.
Gotcha. And so those signs and symptoms sometimes are masked or tried to at least put at bay by self-medicating.
And so and people think, I worked hard yesterday, and they associate too many things as the cause, and not realizing that one of the main things we always got to focus on is our stress levels. This world that we live in, the pressures on everybody's shoulders, it's growing. It's really hard to alleviate our stress. And now we're trying to work more and more. More families have to have the wife and the husband both working. So then they have to come home. And so then there's a lot of work once you come home and raise a family. And so there is just a tremendous amount of stress on people's shoulders, and we're not giving ourselves enough sleep. And because we're tired and exhausted, it's hard to go home and make a great meal. And so people aren't eating as nutritious as they used to. And it's so much easier just to stop and pick something up in the drive-thru. And so because of the stress, lack of sleep, and the poor diet, more and more people are getting hit with this chronic fatigue.
Let's talk about, I'll call it self-induced fatigue, which means it's common, like it's going to come. So let's say, for example, I know we like to be outdoors. You were just on a 30-mile hike. That's fatigue that's going to come because of exertion and effort. And everything
in your body hurting.
Yes.
That was an amazing hike.
Yeah. Right. So there is fatigue that is natural and going to come whether you are dialed on the hormone level or not, or if your diet's perfect or not.
I mean, when I was in medical school, we'd be up studying for a big test. And so I always had to let myself recover from that, right? So yes, it doesn't matter if you're in school or if you're an accountant. I know my accountant just went through tax season and they're stressed, right? There's deadlines and so that's normal, right?
Fatigue's gonna occur.
As long as you let yourself have a recovery from that, your body will most of the time do well.
And that's what I wanted to dive in first. So let's call it natural fatigue, right? Sure. So natural meaning you are
life-induced.
Right, you're trying to do your best already. So let's say you have your hormones dialed, your diet's dialed, and you just exerted a lot of energy. You had a vacation and you were jet lagged, and so there's some naturally induced fatigue, right?
Sure.
What are the best ways to combat that? Obviously, sleep, right? Number one.
Sure.
Yeah.
Basic sleep and healthy foods. Make sure you're counting your macros. You're getting some protein, eating some carbs, but also eating healthy fats. But the truth is that the cheat code that that we love that's where I get into like IV vitamins. And sometimes when you have a heavy thing going on, there's a way to get an IV of all the minerals and nutrients that your body needs. And boy, it's a game changer to help
get ahead of it also, right?
Totally.
Not only post, but pre if you can.
Totally.
Okay.
In fact, last time we went over to Europe, we got one before we went. We flew, never had jet lag, enjoyed the whole trip, came back, got one on the way back, and never had post-recovery jet lag problems with our amazing trip. So yeah, there's so many ways to help yourself through natural or common causes of feeling tired and exhausted.
What about exercise? So the last thing I want to do after, you've gone on I remember you saying the day after you came back from that 30 miler, you went out and did some more hiking. Was that helpful for your fatigue as well to get lactic acid out? I mean, what was the play on that?
I think that was mostly to help the recovery, because I was so sore, and just to get the lactic acid out of the muscles and to keep moving. But there are athletes that are pushing themselves too much,
right?
And they're overstressing the body, and that overstress through physical exercise can also affect, one of the common things I think we're going to talk about today, which is our cortisol levels. And so over exercise can also cause us to be too stressed. And so then it affects our adrenal glands, and then we have issues.
In a negative way.
Yeah.
Okay. All right. So staying in the same vein of kind of the natural fatigue, right?
Sure.
And we'll do a full podcast on sleep, because I know you have, a lot
to talk about.
Yeah, a lot to talk on that. But just in general, is it good to try and medicate to get to sleep when you're tired like that, or is it best to naturally try and go to sleep? I mean, what's your recommendation on that?
Well, anytime you can naturally sleep, by far that's still the best. The research is showing that there are so many health benefits. Anti-cancer effect, every muscle joint recovery. There's a brainwashing now that we're seeing that can take out some of all the toxins on our brain when we get at least 7 to 8 hours of sleep one a night. And so the most important thing is to try to allow yourself to get the most amount of sleep. Now, if you are doing that and you still can't sleep, well, then there's some natural things you can do to help with that. One of the most important for women is to make sure you know how your progesterone is, because progesterone is unreal with what it can do for helping sleep.
The cheat code for sleep.
It is so amazing. Helps all women sleep better. Men cannot be on that.
Okay.
And so, but if they're checked and their progesterone's right, then make sure your thyroid is right. Because when you're in a condition called hypothyroidism, or where you don't make enough thyroid, you'll also have fatigue, but you also find that your sleep is not quality sleep. But then you could also get into adrenal fatigue, because cortisol also affects that sleep. And so there are some hormones that if you're really trying to sleep good and you're giving yourself the time, but you don't feel like your quality of sleep is, that's when I would go in and get checked.
Okay.
If the bigger thing is, always make sure you don't have sleep apnea. I'm trying to make sure that's obvious, and it is super important. And so I'm assuming that by the time they come and see me, that's already been ruled out as a cause of their fatigue.
Awesome. So kind of moving from the natural fatigue, which I think you would agree even more common than just a natural fatigue, which is rare that someone's coming in and they're just fatigued from natural causes. What we see in the practice a lot more of is what type of fatigue?
Well, that's a great question. I would say that when somebody comes in and starts, everybody thinks they have adrenal fatigue. I mean, across the board, men, women, they're like, oh, I've looked up the symptoms and I have adrenal fatigue.
I was going to say, is that usually self-diagnosed?
That's a self-diagnosed. Okay. They've seen their provider and had blood work and everything was normal. But when they read the symptoms of adrenal fatigue, everybody can check most of the boxes. And one, that's because the adrenal gland can do so much for our system. It's so important. My experience has been when I do the full panel of hormones, it's not the only cause. And if it is a cause, it's because there are other causes that are more important that need to be addressed.
And in a rare case, is it the major factor in causing their fatigue,
sure,
right?
But since I've been doing this since 2009, I can put on maybe one hand where that was the first diagnosis that I'd call it, because every single time they would have a subclinical hypothyroid where their thyroid's not functioning right, or they have low testosterone, or their estrogen progesterone balance is off, or their other hormone like DHA, or there's so many other things. And what we found that's so amazing is when we fix the other hormones that are easier to address, your body's not putting all the stress on the adrenal gland to keep up with the demands and the stress and the fatigue in your life. And so once we can help the adrenal gland to fall back and just be our stress gland, which is the fight or flight gland, which helps us in, when a bear's coming after you, this is what we want working wonderful. It helps us get out of there. Too many of us are living our life in that state of overstress. And so that's why the adrenal gland can't keep up all the time. It's not meant to be controlling your symptoms in your life on a daily, continual basis.
At that high of a level.
At that high level, right.
Okay.
Whatever.
We were in the pocket right there. Let's go load. I know the adrenal glands have a bunch of functions.
Sure.
But and you alluded to this, what are the main functions of the adrenal glands, and where are they again?
So the adrenal glands are located around your kidneys. They're very small, so they're in the mid part of your core. The other thing is their main function is one of the most important hormones that it makes is cortisol. And I'd love to talk about it for just a second because it sure seems like everybody is talking about it. It is important to note, but I feel like cortisol is getting blamed 100% as the cause of all fatigue. And that's not fair. What does the cortisol do? First thing is it is most important to help us regulate in our foods. It helps absorption of the proteins, carbs, and fats. It helps with sleep. It helps with brain health and function. So you'd mentioned earlier about that brain fog. Cortisol, when that's really stressed out, it can really cause a significant, where you just feel like your brain is sluggish and you can't think, or especially as you progress throughout the day. It can help with, immune function and your immune health. And so it's just so important. The other thing is it's a very common cause of chronic fatigue. And so when your adrenal glands are not able to cope with the stress, we call it fatigue, which just means they're not able to continue to produce enough of the hormone.
They're just overworked.
They're overworked.
Okay.
Like most of us
already
in our life, right?
Yeah.
They're the same as we are. And so adrenal fatigue comes generally first. It's not a medical diagnosis that most doctors recognize. But as the adrenal glands can't keep up, they're in a state of fatigue, and then they progress to where you can get into an adrenal insufficiency, or what I tell patients so they can understand better, it's like an adrenal failure. They've been burned out. The gland couldn't keep up with their life and their stress for all those years, and so now they cannot even make those hormones.
Is there any going back from that? So you get to that insufficiency or that almost failure. I'm assuming it's rest. It's getting under your stress levels and your sleep under control. I mean, is there going back from that?
There is, and again, my experience has been there's always two conditions going on. It's never just the adrenals.
Okay.
It's your adrenals and your thyroid, or it's your adrenals and maybe low testosterone, or if you're like most of my patients, all of the glands are already going into failure, and so it's just the last one hanging on, trying to keep them, surviving through their life. And as we've mentioned before on our podcast, one of the biggest problems is the way some of the lab tests are measured. The range is so big that people are going in to get their thyroid checked and they're told they're normal. Their testosterone range is so big that a man will go in to get his testosterone, or a woman, and they're normal in the range. And so they think, oh, well, that is normal, so I guess it has to be my adrenal glands.
Right.
And it probably is a piece of the pie, but the truth is, if you learn how to optimize those hormones and let them function normally again, now the stress is coming off the adrenal glands. And I have seen where a lot of my patients that were going into adrenal insufficiency can recover and can get better.
The corrections made just by really alleviating some of the stress on the gland. Okay.
Exactly. And by optimizing your hormones. And so that's why it's so important to work with somebody who can do both, right? I'll give an example. I just had a patient that I spoke to this week. Literally went over blood work. Her cholesterol has lowered almost 150 points. Her triglycerides are like 200 points lower. Her LDL, or what we call bad cholesterol, has dropped almost 100 points in about a year and a half of hormone therapy. Her thyroid is optimized. Her estrogen is optimal. Her testosterone. And I talked to her, and I'm thinking, I was so excited I love you, Dr. Allen. I feel so great. Not at all. She goes, I am so tired. I am exhausted. And so even though we'd adjusted every hormone, she just went through a move. And so she'd been under stress. And sure enough, when we checked her cortisol levels, she had completely been unable to make it. And so not all the time, even if you optimize your hormones, does it always fix the adrenal glands. And so we put her on treatment for low cortisol levels, and so it's amazing. We can fix that. But the problem is, if I'd only done that, I would have missed all these other medical conditions.
Right.
And so a lot of people want to just check the cortisol, and that's great, but you would miss so many other things that can help you feel better right away.
You kind of hit on this, but I was going to say, how does this all affect your hormones? But we kind of talked about how, it can cause stress, the other hormones, but looking at it as a whole picture like we do at Terafé is important because it can also help relieve the stress on the adrenal glands and get your cortisol in check.
Well, again, what you're saying is 100% correct. And the most important thing to understand is you would never drive a car with one of the wheels off.
Right.
So if your cortisol's off, we'll replace it. But if your thyroid's off and you have your cortisol normal, we'll fix the thyroid, fix whatever you need to replace in your system. Make sure it's not just everything thrown onto the one hormone level, because most of us, because of stress, because of our foods, especially because of what's in our foods, we're being affected more and more, that every hormone is starting to have a problem and is not able to keep up with the demands of our stressful lives.
Okay, so we've hit on quite a bit on the cortisol. I understand the adrenal glands also regulate other important hormones for us. Can you hit on a couple others or another that it regulates?
Well, one of my favorites is a hormone called DHEA, or dihydroepiandrosterone. It is personally one of my favorite hormones. It is a sex hormone. And when I say that, what that means is your body can use DHEA as a precursor to any other hormone that your body needs. For example, when your DHEA is high and optimal, it can then go make testosterone for both men and women. It can make estrogen for both men and women. It can also make progesterone for women. But one of the secrets that I love is DHEA is one of the only hormones that can then also increase the production of our human growth hormone. And so everybody loves that, right? Because it's famous and used all over the world
and abused
all over the world.
Right.
But it has a lot of health benefits too. And
right.
we'll do another podcast on that sometime. But so my favorite is DHEA can help so many factors. And so in my experience, before I see people having true cortisol deficiency, I see their DHEA goes low way before that.
Okay. Because
I'm seeing 20 to 30-year-olds having low DHEA and their cortisol is totally normal. And so that's one of my favorites because it does so many things for the body. I'll just tell you a crazy, wonderful, miserable personal experience with DHEA. I've been on it for years. My wife, many of you met through one of our other podcasts. And so we have a regimen where every night, whoever gets in the room first, it will set out the vitamins. And one night's, my wife set it out, and it was my last DHEA. And she's like, hey, you need to get you another bottle. Well, I didn't hear her, or maybe I wouldn't listen. I don't know. I mean, I would never do that.
No, not you.
But we ran out, and I was out of my DHEA. And it just happened that next week we were going down to Mexico. And so I'd been off of it for probably 8 or 9 days. And then I went for a run down to Mexico and came in and thought, oh my gosh, my whole body was hurting. And I was like, I didn't run that hard, or I didn't run that fast. And I thought, well, maybe it's all the overeating I'd been doing down there. And the next day was worse and worse. And then finally, my wife mentioned, she's like, oh, you remember you ran out of DHEA? And I had totally forgotten. And so I had been off of it for, almost 14 days. And the effects of what it did for fatigue, exhaustion, my joints, and how I felt, it was so dramatic. So when we got back, I got some, and within a couple of days, it was all gone. And it was one of the most interesting and hard experiences to go without such an important hormone, because of the dramatic effects it has in our life. And if you're deficient in that, your whole system's not feeling right.
Interesting.
And the best part is it's an over-the-counter vitamin. And so it's not even regulated, and patients can find it. The importance is knowing the difference, because the dose for women is obviously different than the dose for men.
Right.
And so you want to make sure you get the right dosing, and always, when you take it, you slowly increase, because if you try to go up too fast, you can get acne or breakouts. And so you want to just be very cautious with it. But again, it's phenomenal what it can do for your system.
I hear there's a new supplement company hitting the market called Albi Health.
Yeah.
And they're coming out with some DHEA.
It's
Ever
very
heard
exciting.
of it?
I have. Very exciting.
It'd be awesome to get some high quality DHEA to the market.
Exactly.
Make sure that it gets people dialed.
Sure.
It's cool. Didn't know all that about DHEA.
Yeah.
Just know I take it. I'm learning. Back to cortisol. Explain to me what happens when your cortisol is high versus when it's low, and kind of what that looks like, and what someone might be feeling at high cortisol versus low cortisol.
That's a great question. So when you get to where your cortisol is low, which means that the adrenal glands are not able to keep up with the demand, the stress, the requirements that our body is putting on it, and it's to the point where it's not able to make enough, you'll have all the symptoms of adrenal fatigue, if not adrenal insufficiency, which is worse. It's just a progression, and the severity of symptoms are worse. What's interesting, though, is if you have where your cortisol is too high, you can actually start having all the symptoms of adrenal fatigue, even though the numbers are showing high. Why? Your adrenal glands are able to make the hormone, but it's making it so high, and it's working so hard that the stress is burning out the gland.
You're getting all those symptoms still.
Yeah, it's because it's having to work so hard. And so it's, you could be in a honeymoon phase, which means your glands are about to burn out. And so they'll push out the most they can in the last, few months before they do. My experience is usually when they're really high, somebody's just coming out of a very stressful experience. What does that mean? It could be an illness. It could be a divorce. It could be loss of a loved one. It could be something that is acutely stressing the body out. It could be a new job that you're working more hours, or
a big hike.
Something, a large event in your life. And so if we can address whatever the issue is, and we can help that, a lot of times you can come back down and get back into normal before it burns out. Okay. You know what I'm saying?
Yeah.
Well, thanks again for joining Ben and I. It's been fun talking about cortisol and the adrenal glands and DHEA. But my favorite thing, again, is to talk about fatigue. If you guys are ever dealing with chronic, which means happening more than once a week, and you're having fatigue, please, it is not normal. Get help. You don't have to. You can be as old as me and feel amazing. We'll see you next time.
Thanks, guys.